My name is Cynthia Escobar, and this is my treatment program final assignment. So, going into this assignment, I wanted to create a treatment program that's very inclusive and diverse and open to anyone of any age. Of course, 18 years and older, and this basically program being 30 to being 1 to 3 months. It'd be best recommended to do 90 days, and that's our length that we would have. Of course, for those who need more time, there's an extension as well to this program. We provide full help 24/7, and I think it's important to do this just because, each minute, each hour, there's something going on, and that's why we have this program here. And kind of employees going into this program, we're very inclusive and again diverse, just being open to all, and sharing our cultural differences. We get a lot of individuals that are going to come into programs where they don't feel like they're a part of a program because of culture differences, and it's important to not only have employees who are both open-minded and very aware of culture differences, but also trained in this aspect because, as Carl Rogers himself, it's to have this unconditional respect and this open mind to meeting all patients coming in, and all of them going through the struggles, and it's a difficult time for them, and it's important for us to be very welcoming in this program. I'll start with the types of services that this program provides, which is a detox center, an inpatient treatment, outpatient treatment, holistic therapy, individual and group therapy, family therapy, trauma therapy, CBT, which stands for cognitive behavioral therapy, MET, which stands for motivational enhancement therapy. As you will see, most of the services, it has a lot of different types of therapy, and it's important to have such a selection because not every person is the same, and not everything is going to work for the same person. We're going to have to go through our stages of what works best for the patient, but also it's important to really have these discussions with these individuals to see what they think works best for them. And it's of course knowing what kind of journey they're going on, what are they struggling with. We know going in here, they're having an addiction with alcohol, drugs, but it's going really deeper and diving deeper to where these problems arose and started. And next following slide, I go a little bit into more detail. Detox Center, our program helps individuals who are struggling to stop drinking. It's our goal to provide a safe and welcoming atmosphere where the individual feels comfortable and can detox from alcohol in a medically supervised setting. It's a challenging process that can cause dangerous withdrawals, symptoms. Staff will provide full support emotionally for a smooth process. Also will provide medical staff for safe measure and therapy to talk about their emotional issues, and of course medication to elevate withdrawal. So again, we're full 24/7 helping these individuals who in the detox process. It's not an easy process, not a process that not everyone can do on their own, and it's important to provide these options of help for our individuals and these therapists to talk about this process, and to also have full-time nurses and EMTs to help them on the medical part, because withdrawals can be dangerous and can be life-threatening to individuals depending on how far this addiction has gone. And of course, this is a program that has inpatient and outpatient treatment. Inpatient treatment, of course, we know client lives in the program, and I want to and our staff provide this program as a home-like setting where individuals work on their recovery from their addiction. We don't want to make our employees feel in prison, so our program is very home-like structured, very homey, and colorful. And we want the individual to feel at home, want them to feel like they're somewhere in a positive light and not being punished. This program, again, it ranges from 1 to 3 months, but we understand life can get in the way and recommend at least 90 days. Of course, it doesn't happen all the time, but we are here to support these individuals who come and who leave and come back. We have outpatient treatment, recommend high levels of care, and best types of therapy to these people. They have full knowledge of how to keep their abstinence from these substances. We provide the best types of therapy for them: family therapy, holistic therapy, individual therapy, group therapy, and trauma therapy. We also have CBT, which is a form of therapy that helps individuals basically individuals talk about their negative thoughts and how we can turn and focus on modifying those negative thoughts, patterns, and behaviors that contribute to the addiction. And then we have EMT, which again stands for Motivational Enhancement Therapy, a counseling approach that helps the individual identify and strengthen their motivation for change, which is an important part of this process, because a lot of us going into this, we understand that not many are motivated to change or don't have the motivation to change, and it's important for our staff and for all of us to really have this positive attitude, and for these individuals, no matter how hard it gets. Holistic therapy helps individuals develop a deeper understanding of themselves. This is where individuals learn to develop coping skills for long-term recovery and other things as exercising, just getting them into activities. And it's a good form of therapy for individuals. Again, not all therapies are going to work for the same individual. And that's why we provide a selective options for them. Again, we have individual and group therapy. Group therapy helps because, putting them in a circle where they're able to talk about their drug addiction, alcohol addiction, where, they're not the only ones going through it. It's good to have other people around them discuss their stories as well, and, let them not feel alone, which is good. We have trauma therapy, which is the underlying cause of substance use disorders. After detox, the mind becomes clear, and it's important to discuss the reasons one began abusing. We incorporate CBT and address the person's thoughts and beliefs that drive their behavior, and just go around how to change it, which is, again, is a process. Family therapy. Many individuals have damaged relationships among family members. We build skills like conflict resolution and healthy boundaries among the family, creating a healthy household. This is where we get to involving the family, which is not for everybody, but it's a process. And again, it's when the individual feels like they're ready. Again, they get to choose the type of therapy they feel is best for them. Next is types of counseling, which we already discussed. We have individual and group therapy, family therapy, trauma therapy, holistic therapy, CBT, and MET. Types of employees. This treatment program is inclusive and diverse. Again, we want to include employees who are very open-minded, very willing to help these individuals who come into this program. Of course, we have staff that are going to be having doctorates, bachelor's, associate's degree, a few nurses, certified EMTs, counselors, and psychiatrists. It's good to have just a range of selective workers here, because we all have different knowledge and how we incorporate in helping these individuals. Types of programs is 12-step program, again incorporated with CBT, MET, and holistic treatment. 12-step program, strong peer support group that helps the individuals maintain abstinence from substance based on spiritual principles. And it may not seem like it works, but it really does. Support of family. Of course, our program will provide as much support to help individuals reestablish relationships with their family, but also create an environment for them where they feel close and open up to our staff. It's not only them receiving help from them receiving support from their family, but as well as the individuals that work here and the staff. We want to create this environment where they feel safe and they feel very comfortable staying here and not wanting to leave right away. And then we have types of recreational service, which are the activities to help individuals, which include community outings, sports, music, yoga, exercise, and arts. Include to also not feel like they're just here doing the same routine of going through therapy, the detox, because sometimes it could get very tedious or it could just get very overwhelming for individuals. So this is why we have recreational service, where we have them doing activities like community outings, doing some hiking, some activities outside that get them involved. Sports, music, yoga, exercise are just activities that really just keep them going and not feeling like they're trapped in this prison of therapy, because again, it's not going to be for everybody, but this is why our program is going to provide all this type of help for them. And that's it.